I'm Laurel Willig. I'm the Pediatric Nephrology Program Director as well as the Medical Director of the Genome Center here at Children's Mercy. There are so many great things about working at Children's Mercy. One of my favorite things is that we have such a collaborative group of nephrology attendings and fellows that there's always someone I can learn something from. We are constantly reevaluating what we do and asking if we can do it better.
The teamwork and excellent multidisciplinary care, particularly across different silos, was immediately evident to me when I came to Children's Mercy. I've especially been impressed at how people are so willing to think outside of the box in order to achieve our goals.
What drew me to the Pediatric Nephrology program at Children's Mercy was the reputation. We definitely have been in the top 10 of children's institutions for multiple years in a row, so I knew that I was going to get great training. Specifically, we have really great dialysis training, and not every institution offers that. We have dialysis technicians, we have dialysis nurses, and some of the best dialysis doctors in the country, and we are really kind of leading and spearheading the research in a lot of dialysis methods. So I knew I wanted to learn from the best, so coming here was a no-brainer for me.
The fellows in our nephrology program play a key role in the management of these very complex dialysis and transplant patients on several fronts. Of course, many of these children, unfortunately, are hospitalized with complex problems, and the fellows are at the core of caring for these individuals, along with the faculty, all of our team, and all the residents that are caring for these children as well. But in addition to caring for these patients when they're inpatients, our fellows have the opportunity to care for dialysis and transplant patients as outpatients over the course of their training. And so during that training, I think that the fellows become very adept at taking care of the medical issues surrounding the care of children on dialysis or transplant recipients, as well as the psychosocial issues. And so I think that makes them a more rounded physician, and when they leave Children's Mercy, they are really well adept to care for all these children with dialysis, with transplant needs, in a very optimal manner.
I think that for any pediatric clinical fellowship, the first goal should be turning out very competent and confident physicians. And with us being a large regional tertiary care center, we do see all those common presentations as well as the complex referrals. So you're really able to gain confidence, gain exposures as far as managing the wide breadth of pediatric diseases that we see.
The fellows will have an opportunity here to work with the Neptune, the CureGN, and the CKID study if they so wish. In addition, we also have a bone and mineral disorder clinic. So if a person is interested outside the kidney, they can definitely be part of our research in the skeletal and metabolic disorders. So in a sense, here at Children's Mercy Hospital, we let the fellow drive the project, and we generally don't force them to work on a project unless he or she is passionate about her project and work.
You should consider coming to Children's Mercy for the Nephrology Fellowship for a lot of different reasons. The people are great here, and there's a lot of different opportunities, a lot of research, whether it's bench research or clinical research. Along with the clinical side of things, the inpatient service, we have our own team with residents for our nephrology patients.
I wanted to train in a place where I could care for patients that were coming from different backgrounds, from different cultures. Not to mention that Children's Mercy has been a leading institution in diversity and inclusion, and that was really inspiring to me. And last but not least, research was a big important factor for me. And being here at Children's Mercy, I can see that we have a vast number of opportunities to join in research, and especially now that we have our own standing research institute. And it really has been wonderful to have both the advocacy and the academia come together and just be the ideal place for me.
While I think a lot of Pediatric Nephrology Fellowship programs offer wonderful educational experiences, one unique thing about our fellowship program is the way we embrace change. We are constantly trying new things to improve not just the fellows' education, but their work-life balance. We take our fellows' comments to heart, and I don't think there's been more than 2 months during the whole time I've done this where we haven't tried something new to make something better for our fellowship and for our fellows.
Now, it's unfortunate this is a virtual interview, and I think the one thing that's missing is having you visit us at Children's Mercy. And I think that you would see it, not only are the people terrific, but the facility is terrific. The resources we have, the ancillary services we have, people that you would interact with on a daily basis are people that you'll be friends with, that you'll count on, and you know that they count on you. I have been at Children's Mercy for nearly 40 years, so clearly I think it's a good place to be, a good place to work, and a good place to care for patients.